Good evening, colleagues, ladies and gentlemen. Thank you so much for joining us again on this beautiful Thursday evening. Welcome to the Clinix Health Group webinars that we have the privilege of hosting week on week. And we thanks the Clinix Health Group one more time for being kind enough to sponsor these webinars so that it is free to all attendees that join us every Thursday evening. And we also want to say thank you so very much to Lakele, Nasisa, and Neo in the background. Thank you for ensuring that everything and all the systems are running efficiently and effectively. And a special welcome to our guest here today, who I will speak a little bit more later, Dr. Mampane. He's actually been trying to connect, and we were at the last moment able to get to connect successfully, and we look forward to a riveting presentation from his part. Just from a housekeeping rules point of view, as you all know, you were able to register following receiving that link that was sent to all the participants here this evening. So the registration would then send you a link that you would click on and you would come here. Some of the colleagues were sending each other the link. And when you click on that link, you came to tonight's presentation, but chances are you will not be receiving your CPD points or any other affiliation that you have with other bodies, and it will not give you your points. So please make sure that you do register and click that, and we'll be able to submit and give you your points thereafter. The same applies for the other disciplines. So it's not just only for the doctors or those registered with the HPCSA. During the course of the presentations, as you already know, colleagues, but there are always new members of the committee attendees that come here every night. Frankly, I feel, Dr. Mampani, because we go through it every single time, it's like when you fly on an airplane, they always go through the rules as the hostesses and so on. So they go through all of that one more time. So I'm going to do this each and every time just to make sure that everybody that's joining us here gets the full benefit of attending these webinars. So during the course of the presentation, we will disable your videos as well as your microphone, so you won't be able to speak at that time. However, feel free during the course of the presentation to go into the chat section and enter any questions that you may have or any comments that you wish to put forward. We will most certainly look at those, and towards the end of the presentation, we will then address all of those questions. Dr. Mampane is quite excited about it, especially the more difficult questions about why Kaizer Chiefs did not win the league this year. And maybe that will be part of the trivia that we will put forward. I asked Dr. Mampane what happened. He told me that Chiefs climbed the ladder one step at a time. This year they were third in the log. And so I understand next year they're going
Yeah,
to be second. And
Rome
then,
wasn't built in a day.
and so apparently it wasn't the Kaizer Chiefs team.
It's
So,
fine. I'll take it. I'll take it.
so Doc, thank you so very much again for joining us this evening. We're really excited that you came on board. We know that you were well recommended by Professor Maswime. Salome Maswime has put forward a number of fellow colleagues who have presented quite exciting, riveting, as well as insightful content with us here, especially from a research point of view. And you being what is it, team doctor now for the Springboks for what, 10 years. So
Yeah,
we really
very
thank you
long.
so very much for, yeah, it's a long time. It's a long
It's
time.
too
And
long.
then of your affiliation with Kaizer Chiefs. Colleagues, Dr. Lehlogonolo with a G because he said it's Pedi,
Hmm.
Jerome Mampane. He's a sports and exercise medicine specialist with MPhil in sports and exercise medicine. And for over 10 years, he's had experience at the elite international level. So he's a team physician for the Springboks, spanning two World Cups. You were on the field, you were celebrating the
Hmm.
victories. So we have that on record. And so we want to thank you. And he also is a team physician for the Kaizer Chiefs Football Club, who is going to win the league in 3 years from now.
There you go.
Then,
2 years.
and
2 years.
2 years from now, he also has the capacity to function capably in high pressure clinical environments. He is a follower of Christ, a husband to comfort.
Yes.
We must be really proud of you this evening. He's a father of two. The names of your children?
The Wesian Nkosi.
Beautiful. Almost like the Kaizer Chiefs team, Makosi, and a father of two, and one of the founders of Sports Medicine South Africa. Uh, Dr. Mampane is dedicated to serving others with integrity and professional excellence. We most certainly have been looking forward to this presentation. I'm going to just turn my camera off momentarily while you do the presentation. Feel free to take your
Perfect.
time. Our
No,
colleagues
perfect.
excited.
Perfect.
So leave your camera on. And I know it shows you as Burton Shinners on the screen there, which is going to confuse a few people, but we really are excited that you stayed to be joining us this evening. Over to you.
No,
Thank you
thank
very
you very
much,
much.
Dr. Mampane. Thank you.
Perfect. Thank you. I appreciate the opportunity to be sharing with the colleagues this evening. Firstly, thank you for the time and opportunity to share some thoughts with you colleagues and all the, well around concussion in youth sports. Thank you, Salome and the Clinix group for considering me for this clinical opportunity. I am Lehlogonolo Mampane, a sports and exercise medicine practitioner based in Randburg at Sports Medicine Africa with Doctors Macheti from the Bulls, Masango from the PSL Champs Pirates, Dr. Naidu from the Springbok Women, and our latest doctor to join us, Dr. Skarp, together with our rehabilitation team, Sashin Palyam and Tabang Demo. Look, I wish to thank God for this opportunity, this learning and growth opportunity. And again, as well as to thank you, colleagues, just for your time, spending time to actually listen to me speak. Um, so I'm going to be speaking to you about concussion assessment and management in youth sport. Um, and basically for me, at the end of the session, what I'd like to have achieved, right? I'd like to have stimulated just some consideration and interest in each and every one of you, just around your approach and your management of concussion in youth athletes. It's been just quite something that has sat on my heart, and also quite a bit on my mind, considering the kind of patients that we deal with and the burden of disease that it's had for some of our patients. So, why does concussion matter? Well, concussion is a form of mild traumatic brain injury where patients present with transient disturbances in brain function. These invariably have an effect on the patient's normal activities of daily living. So patients may present at various stages and time periods following injurious events. And this ranges, honestly, the presentation time ranges from maybe a same day presentation or even up to never actually consulting at all. And there are various reasons for this kind of thing, which I want to highlight the attitudes towards concussion and cultural norms, within our society, which influence the responses towards such injurious events. Because I'd like us to be united, in educating our patients and their parents specifically, just around concussion events. So the image below that you see there, the symptoms of suspected concussion, illustrates the symptom profile of patients ranging across physical, cognitive, and emotional domains. There'll be a time for Q&A at the end. So if there's anything that you want to ask around some of these slides, please maybe just keep track and let me know. Um, Again, concussion matters because young athletes are more vulnerable than adults. And under recognition and unsafe return practices place athletes at risk of second impact injuries, as well as the sequelae thereof. Concussion also matters because, we're a rugby mad country, and rugby has one of the highest concussion incidence rates in youth sport. Concussion requires early diagnosis. It requires appropriate multidisciplinary intervention and management to allow youth athletes to return to their normal lives, their normal sporting lives or their normal schooling lives. And lastly, concussion matters because of the burden associated with a lack of management or any sort of mismanagement that tends to take place. There's a young man called Cody Lee. His story is there online. If anyone's interested in looking at, he would have had a second impact following his first acute concussion. And basically, the resultant effects thereof are quite devastating, not just for him. I put the picture there that he's with his family, but it's for him and his family. Once a strong American footballer, now a person who's basically confined to a wheelchair. So, how does concussion occur? Well, concussion occurs in our setting usually through direct impact or acceleration or deceleration events. I don't think I've seen a blast injury in rugby. I mean, geez, wonders never cease. You never know. Um, so the incidence of concussion in youth sports. In an article titled "The Incidence of Sports-Related Concussion in Children and Adolescents: A Systematic Review and Meta-Analysis," published in April 2025, I came across an incidence rate of 4.336 concussions per thousand player hours across 7 sports, and included amongst that was specifically rugby union and American football. So, I mean, we can mention American football, but just to point out that there's this theme of rugby union coming out and being associated with this concussion. Now, I was fortunate enough to be able to get some data from SA Rugby through Dr. Clint Redhead. I wanted to show you an image of the incidence rate of concussion in our youth, in our SA Rugby Youth Weeks, basically ranging from 2019 to 2025. Again, just bear in mind that when you see such low incidence rates in 2020, 2021, and 2022, you're looking at the years where we were dealing with the sequelae of COVID and how it was being managed within the general population. So that may basically just very well just point to the fact that there wasn't any rugby taking place. So no rugby, no concussion in essence. Um, so this slide just illustrates some data collected from the under 18 and under 16 SA Rugby Youth Weeks. If you just notice that year on year, there may be a shift in the athletes that get concussed. But if you look at it just from last year's results, you'll see that the under 18 boys seem to be the group that seems to be maybe at more of a risk. The slide also then is meant to illustrate to you or show you the year-on-year incidence rates of concussion at the SA Rugby Youth Weeks, but also now including the girls' youth weeks as well. Again, still it's under 18 boys in 2025 that had the highest incidence rate of excuse me, of concussion in all the youth weeks. Again, when you look at this slide, this now just illustrates the incidence rate of concussion in varsity cup rugby. You can just see that it still is higher in the SA Rugby Youth Week. And then also the other thing is you would consider the duration or the length of duration of the SA Rugby Youth Weeks. And that's what makes it interesting that still such short tournaments have such a much higher burden of injury or burden of injury, sorry, compared to prolonged competitions like a varsity cup. So the mechanisms of concussion in youth rugby, the tackling event actually seems to be the most significant contributor to concussion events. Look, there are a number of things I think that are important to start noting. In the tackle event, there are two parties. There's a tackler, there's a ball carrier, and both are actually at risk of head injuries, and that's based on whether they've got good technique, how they enter that collision. So it's important that the message goes out when you speak with I don't know if anyone is involved with schools, but you speak to coaches, you speak to teachers, just to speak around how children are educated around tackle technique, tackle entry. Those things have quite an effect on the potential outcomes with regards to concussion incidents. I want to point out that when you look below on the slide, I would point out that the tackle height laws came into effect during the 2024 season, first being implemented at Varsity Cup rugby level in 2024. And while there's a discussion around the number of penalties decreasing, I just want to go back on the slides and just show you that if you look at 2024, it just doesn't look like it was that significantly different from 2023. And maybe it's worse actually from 2020, well, 2025 is actually worse in under 18 boys than in 2024. Um, Again, with this slide, I want to thank Ross Tucker for this one because I think, what I was trying to illustrate in showing you this was the tackle event actually is the one event that is really associated with these head acceleration events. And basically, that's where the athletes tend to be quite at risk of sustaining a concussion. So again, SA Rugby has quite a great what's it? I've actually requested Burton to just share it with you guys in the group chat that you can have a look at this PDF sheet. I thought it was quite a good PDF to actually just illustrate where it talks about the tackle specifically being quite a at-risk situation with regards to concussion. Um, because the tackle was so risky, World Rugby then embarked on basically law changes to try and reduce or lower the tackle height, and I mean with good reason as well. Excuse me. If you just look and you see how the incidence of head injuries where the tackle height hasn't been lowered is higher, significantly higher than that where the tackle height is lower. I mean, it doesn't take away from the fact that concussions still occur. Players can still have head to hip contact, head to knee contact. It still can happen, and some ball carriers can really dip their heads pretty low that you end up having head to head contact. But I think the rationale behind it made sense when you look at the incidence rates. So what has changed? Well, currently, if you look at the tackle height laws, the expectation then would be for your child or your son or your nephew, your niece, or a friend's child, basically to be tackling below the sternum. I want to show off Kaizer Chiefs here first. So below the sternum. Um, Anything that's above the sternum then may be at risk of being penalized. And should you have head contact, it's very possible that you may end up with a red card and basically ejected from the game. So what are the clinical features of concussion? Well, again, as we spoke earlier, these span across different domains. Um, the physical symptoms tend to be quite, which we've encountered commonly, has been headache. Sorry, forgive me. That has been headache. I must say, and the balance disturbance. I found that the cognitive symptoms, the most recent that maybe stunned me a little bit was the slowed processing that I noticed in a young athlete who had hit her head on the netball court. And also emotional symptoms, which her parents also reported, things like irritability, the anxiety, a lot of sadness, and there were sleep disturbances, sorry, also that were mentioned. Again, the other thing to note is that while loss of consciousness does occur, it's in a minority of cases, and it shouldn't be the criteria that you use to just diagnose concussion. Maybe look and say, oh, well, you didn't lose consciousness, therefore you weren't concussed. Um, with regards to these clinical features, there's a lot of tools that are out there that are available to clinicians. I'd recommend that we each just try and familiarize ourselves with these things. They're good, useful tools that you can use within the first 7 days to actually just help diagnose concussion in athletes. And then these tools also will basically just give you these clinical features and allow you to assess your patient appropriately. The patient at least then can give you their feedback regarding the symptoms that they're experiencing and how the symptoms that they're experiencing are actually affecting the activities of daily living. My personal preference has been to use the HIE3 form. I don't recommend that you use it per se because I don't know, you usually need permission to be able to use this. But I like this because I think from my side, I find that I can quantify better the burden of illness or burden of injury with regards to the patient. Um, Again, I'll say to you, these resources are available online. It's not hidden from anyone. So please feel free to search for it, have a look through it. But it'll detail the symptoms. It'll detail when they were at their worst. It'll detail when they started. It'll also detail how long they've been present. And then it'll speak to the patient that presents in front of you at that moment. Do they still have symptoms, excuse me, in this current time that you see them? Now, for sideline assessment of concussion, um, I think the most important message that must always go through within the community game is the idea around if you suspect that there's been a head injury, I almost feel like even if you're a parent at a school and you're trying to hide that you're a clinician, doctor, physio, whatever part that you're playing, I just feel strongly that I think it's incumbent on you to step on the field and actually recommend removal of the athlete from the field immediately. There was the idea of introducing something called the blue card in SA rugby, which the implementation I think has been challenging. But I wonder, I'd really love to see what more has led to it being so significantly challenging. But this card was meant to help recognize concussed athletes and make sure that they don't return to play, basically the very following weeks as coaches would have them. But if you recall, when I started, I said one of the major issues I sit with is the prevalence of adverse attitudes towards concussion or a lack of understanding even with regards towards concussion and the burden of that kind of injury on athletes. So again, it's important that again you emphasize, well, I think there's a bit of a doubt, you should be sat out. It's important that when you see something that suggests that it could be a concussion, that you maybe are stepping up to be that parent that says, listen, no, this child should be off the field. Um, the other things that are important is to also understand that there'll always be one extra tournament. There'll always be another tournament. There might not always be the same child. One must realize that the things that have been common, that have like been commonplace, things like athletes that return on the same day, after it looks like their symptoms transiently got better, those things should really be eradicated from the game as well. There are some red flags, of course, but my basic recommendation is whenever you come across these incidents, I think as has been practiced for us, in collaboration with Lehlogonolo Hospital, we found that we send our patients straight through to Lehlogonolo Hospital A&E. They'll be assessed there, and there's a time for them to be monitored. I still think it is a worthy exercise to have the children taken to a place where they can actually sit and be monitored for a good amount of time before being released to head home. Again, sorry, just the last take-home message that's important is when you are in doubt, just sit them out. Again, we've spoken about the number of tools that are available to you as clinicians. Just to remind you, the SCOTE for office assessments, and you've got a SCAT-6. For those that know how to use it, Child SCAT-6 for children under under the age of 12. And then again, there's a number of things within your rooms that you as a clinician can do. One of the things I do tend to use quite a bit has been VOMS testing, especially where there's quite a bit of uncertainty in terms of whether a patient is concussed or not. And there tends to be some sensitivity sometimes in eking out the symptoms of concussion when these tests are actually applied to patients. I find that when you get into things like neurocognitive testing, computerized neurocognitive testing, for me, I found value. Again, I'm not saying there isn't any other value, but for me, I found value when the patient actually has had some sort of baseline assessment with the practice. So whether that's happened at the start of the year or, a few months before that, not maybe more than a year before that, but within that same year, I find that then I can try and correlate the data with how this athlete is developing at that point in time. There are different components to the SCAT-6, of course. There's a symptom evaluation, cognitive screening, neurological examination portion, and then there's a balance and coordination testing portion and a delayed recall assessment. Again, I would say as much as, maybe I've instructed here that it's useful within the first 72 hours after injury, I still go on and say to you, maybe even up to a week, you could still use it effectively. And then there are management principles that are important when it comes to managing concussion. One thing that's important to remember, which I just would like to really emphasize, maybe I will type it out as well into the chat. The minimum stand down for concussion, like for any athlete, must be 21 days in the community game. There's no one that returns to 14 days. There's no one that has access to advanced care, where basically they're living with a team physician, a team physio. They've got this specialized rehab team that can monitor them day and night. I don't think many community athletes, many youth athletes are sitting in that kind of situation. And certainly not even if their parents are clinicians. I don't think that it makes sense that they return earlier than the 21-day mark. So again, the rest of the principles follow what is on the graduated return to play plan. And I would again recommend that as clinicians, let's not be afraid. Let's go and familiarize ourselves with this process, familiarize ourselves with how to write it out, eke it out, and actually individualize it for our patients. Um, I highlighted sleep disturbance as well here because I think it's important within your management of managing your patients that you actually address any sort of sleep related issues. Find appropriate measures, ways in which you can supplement sleep or assist sleep. And then remember, when you start managing these athletes, it must be a multidisciplinary approach, must be holistic. You've got to be aware that the individual that's appearing before you has a family, has their school and academic responsibilities, has their sport and passion and hobbies that they actually want to engage in. You've got to make sure that the holistic approach looks into these elements and make sure that or helps this athlete return safely to these various things. So what I've prepared here was just to show you maybe an example of what kind of a sick note I would be writing for an athlete that would have, well, a school-going child that would have sustained a head injury. And one of the things I'm always cognitive of is academic testing. I mean, we're in the period of exams now. I know a lot of us parents on this webinar are probably preparing for exams like we're writing our exams ourselves. It's important just to remember that again, if cognition is impaired, then the expectation of your child to perform or any athlete to perform academically should be really considered carefully. I tend to give athletes or students that are hurt time to actually recover before I consider that they should be returning to testing, academic testing activities or assignments that actually require quite significant amounts of concentration. Um, the GRTP plan, while I've written there, I think I would still go back to saying to you, there's quite a lot of good resources out there that are worth looking at, making sure that you take those. And I'm happy to share those. I think please take my email address for anyone that's looking for those. And I'm happy to share as many resources as are there. But have a look at those and make sure that you tailor it in an individualized manner within your multidisciplinary setting to allow your athlete or the school-going child to return to sport effectively. So I've written up what would be my kind of GRTP example. I took some time and I adapted this from what I read from the English recommendations, from the English Rugby Union recommendations. Day naught, of course, will always be when the athlete was injured. And stage one, I try to flesh it out quite a bit, especially when it's school-going children. I have a low threshold for returning athletes before 21 days. I think again, I'm open to criticism with regards to that. But I just feel like my perspective is the developing brain just needs to be protected. And hence these tend to be quite fleshed out over quite a large amount of time. But one of the things that I also tend to do is I try to detail what a good return to school plan would look like for the athlete. I try to make sure that I've detailed the expectations that there are with the other parts of the multidisciplinary team, whether that relates to vision training, vision testing, or vision management, or whether that relates to physiotherapy, or whether that relates to any other rehab associated processes that the athlete needs to actually participate in. So most of these, if you look at the big headlines, I will write it out clearly as I have expectations for the athlete to participate in that. I'll write out their stage one, I'll write out their stage two. I'll detail exactly when I think it's safe to return to school. And if those parameters are not met, I will reevaluate the child and actually just try and prolong that period to an appropriate time that they can actually handle the academic environment. And also part of being fair with scholars is remembering that there's quite a lot of stimuli within the schooling environment. So if you think that a child is presenting to you with headaches and visual symptoms following their concussion, and maybe auditory symptoms as well, and you send them back into a schooling environment that's loud, that's full of bright lights, full of friends that are making the loudest noise that you can ever imagine, a lot of stimuli, then I think you're going to cause just a prolongation of those symptoms, or you're going to contribute to the prolongation of those symptoms if you don't manage that athlete appropriately. Again, when it comes to the exercise prescription as well, I try to prescribe exercises I would see fit or I would think there would be benefits. So I do also flesh out certain stages to say what I expect during those stages. I try to find alternative modes of exercise that can be used to assist with those stages. So if swimming is far more acceptable, or cycling is far more acceptable, then the athlete for me can go into those kind of things. And then once we get towards the end of the stages and we're getting towards stage 5, where there's an expectation that they return to contact, well, I think it's important then at that point to get to be specific with regards to the sport that your athlete is in. If your athlete is a footballer, it's important to make note of the fact that your football athlete needs to be able to return to headering the ball, needs to be able to return to scrimmaging, contesting in corner kicks. It's important for the horse riding athlete to be able to return to trotting, show jumping, or jumping over certain obstacles with their horse. It's important for the rugby player to engage in different facets of the game, whether it's rucking, it's line out, it's mauls, it's scrums. It's important that you see that that athlete, before you agree to them returning to competition, is safe. Sorry, was excuse me. Now, prevention strategies in youth rugby that are important. For me, if tackle is a problem, then tackle technique has to be one of the major things that is dealt with. Um, I would say that that should probably want to be one of the major things that's discussion points around school sport or around any sort of um, what you call a school PA, school parental association discussions with the sport departments at the schools. I think it's important to point out to coaches things like tackle technique. I think that's safe coaching of athletes. It's important to also ensure that your coaches actually understand the law modifications and what laws there are. It's important to ensure that you as colleagues have emphasized the need for kids to have good, strong necks, especially those that want to engage in contact sports. It makes a difference in terms of reducing the incidence of concussion. And then it's important that you educate parents. I think, again, going back to what I was saying, I think there's quite a lot of prevailing attitudes that don't support good, safe practices with regards to the management and recognition of concussion. I think in our setting specifically, one tends to find the expectations that, toughen up, boy, you're a man, you need to just handle it, you're on the rugby field, take some cement pills. All these terms tend to be thrown around, but it's usually to the detriment of the athlete. So some take-home messages. I just think it's important that we educate quite a bit. I think it's important that we participate at different levels, especially those that are parents, those that are involved with clubs, those that are involved in the parental associations. I think it's important that we educate quite a lot, and that we highlight it, just because of the burden of injury on the family unit, on the student athlete as well. Understand that when managed well and managed effectively, most athletes will really recover and they'll do well. Understand also that a good multidisciplinary approach should be part of your skill set or your tool set to actually manage these athletes. And then consider that when these athletes present to you, if they're presenting numerous occasions, start thinking and having conversations with them about their long-term brain health, because those are things that do matter as they grow. So again, thank you for listening and thank you for the time. I hope maybe in the Q&A section there'll be an opportunity maybe just to engage significantly enough with regards to these matters. Yeah, that's me.
Thank you so very much, Dr. Mampane. I know that you were sharing significantly, and at the start of it, you were mentioning that you were joined by some colleagues and others that assisted you in terms of the presentation. You can see there's a significant amount of appreciation for the presentation that you have prepared in advance for us. So would you like to just give a shout out to everybody else? I see there are already some hands up, so we will go to the Q&A session shortly. And
I can
by
give
the
a shout
way,
out, yes.
yeah,
I
and
can give a
actually,
shout out.
yeah, please go ahead. Thank you.
I'd like to give a shout out to my wife. I need to score some points. So, yes, a
Yeah.
shout out to my wife.
Hi, Comfort. Good evening. Thanks for sharing, Jerome, with us this evening. Thanks so much, Steph. And then you said some of your colleagues were they on the line?
I hope so. But there were some that contributed significantly, I think, with assisting with the data. And it's important to acknowledge Clint Redhead, Ross Tucker, SA Rugby. I think it's important to acknowledge Clinix for the assistance that the opportunity to and the Clinix associated partners with regards to these opportunities. And then, more to Kabatu. So I can't sit and not speak about the many colleagues who just have contributed to where I am in terms of my understanding of these clinical matters and how I practice.
Yeah,
So a great many thanks to a lot of you. Mamasilo, Jeroen, Wayne Durman, Martin Schwalners, John Patricius. I mean, shoot, so many names, even physios, Tanushree, Anurin. I think I don't want to leave anyone out,
yeah,
but I
understood.
want to thank the guys at Kaiser Chiefs as well for you, Burton, because the guys at Kaiser Chiefs are amazing. So to Ash, Mohammed, and Razan, and Adil, and Dave, and Pumi, thank you guys, and to the Lions Rugby Union as well. I think they've given me quite remarkable opportunity, to be able to be looking after match day medical and to be at the forefront of actually trying to manage sports concussion in
Yeah,
elite athletes, pitch side.
yeah.
Yeah,
Yeah, because for all of us that are watching rugby and you've been team physician for you can leave your presentation open, thanks.
cool.
For the so for the past 10 years now with the Springboks and working with Kaiser Chiefs, was working their way back up to the top. And again, just congratulations to the Pirates supporters and fans that have endured these many years of drought from Lee
And the
and
Arsenal fans.
the Arsenal fans and the Arsenal fans. So thank you so very much, though, for putting it together. So let's move to the Q&A section. It says here, thank you for a fantastic, insightful talk. This is Professor Chris Lundgren. She's asking, do you see concussion injuries with school and club hockey? And she says she's asking as a concerned grandmother.
Cool. Thank you for that question. If I'm honest, my first love is hockey, actually. I'm a
Yeah.
hockey player, a hockey coach, still coach, love it. It's like the love of my life as a sport. Now paddles trying to chase that spot away. But anyway, um, yes, I haven't seen that many concussions, I think, with hockey. I think, again, it's a question of prevailing attitudes towards concussion events. I found that there's an opportunity to now collaborate with the Southern Gauteng Hockey Association. We've been in quite a lot of discussions to try and see how we better improve the injury space with regards to how they look after their athletes. I found that the rules from the FIH perspective don't permit or don't afford you the opportunity to effectively look after athletes. And my experience in hockey has been that there's quite a lot of tough men and women. The perspective is to really try and get back on the field as quickly as possible. And again, that's what makes things like those post concussion recognition tools quite important for spectators and umpires and even the technical table. I think it's essential that people actually take time to assess certain athletes who've had injuries that may signal concussion or that may be concussion. So I haven't seen many. I haven't seen guys actually getting hit with maybe what I've come across has been people getting hit with a ball on the jaw. I just haven't seen many as concussion, and I think it's not that there isn't an incidence of it. I think it's just the attitude towards it is not right.
Okay. Yeah, and it's appreciative that you put forward that we shouldn't rush to get the kids back
Yep.
onto the sports field. But in addition, what you kept emphasizing was even from an academic point of view, it doesn't
Yeah,
mean that the child is physically impaired in some way, that they should still continue preparing for exam, going back into
yeah.
a noisy environment, bright lights. It still hinders the recovery of that child, even from an academic point of view.
And it's quite unfair on the child as well. I
Mm,
must say, I think what I've come across with Trinity House and together with Nuertable as well, I think I found education systems that have been very accommodating of athletes. I know from Nuertable's perspective, much as I was disappointed that there was a athlete that had a second impact and basically was suffering with post-concussional syndrome for a while.
mm,
Um, I found that from an academic perspective, there's quite a lot of support. There's a lot of understanding as long as we as clinicians can work towards just communicating effectively with them. I found that the heads of department or the teachers, they have an understanding of the pressures that surround students and the fact that students cannot perform at their best when they've had head injuries.
We have a recognition, yeah, from Emily Mokhashwa, just saying thank you so much for showing up with your flu and that you made yourself available for us this evening. So thank you for that. Professor Dirk Duplessis makes a comment here and he says, thanks for the analysis. And he says, brain injury is a permanent damage and repetitive, events. It's additive, even when
Mhm.
some events was regarded as relatively minor. Are you finding
Mm.
that happen, that pattern, the increase, and does the severity seem to mount?
So it's an interesting one. I can break it up twofold and just speak of repetitive blows, repetitive minor blows that basically cumulatively become a concussed athlete. And I've seen that in an elite athlete. I've seen that in a very famous elite athlete, actually, where when we played England, the athlete actually didn't mention to me that, didn't even report any sort of head knocks that occurred throughout the whole game. But the
Mm,
cumulative amount of blows that he sustained within that one match versus England resulted in a presentation of a guy who on the team bus was starting to vomit, starting to present with more overt symptoms of concussion. And there's that aspect. And then there's also the understanding that um, one of the risk stratification parameters surrounding how you look at the burden of illness and also the expectation of recovery of athletes has to do with how many concussions they've had. Um, and again, there's a question once someone spoke about and like how many concussions is too many.
mm,
And I don't know anyone that can, put their head on the block and say, look, maybe two, three. For me, I will always say, and forgive me for this, my son, I'm highly against him playing rugby, significantly so. If he could play hockey, I would just, wow, just jump. Um, and part of that has been that I just feel like for myself in the field I'm in, just reducing the possibility of him picking up a head injury, I'd much rather take that option. Because I don't know if my son's the one that has prolonged symptoms after he picks up a head injury. I don't know if he's the one that recovers quickly or doesn't recover quickly. I don't know how many concussions is too much. I just know that we like to quantify anything over 5 lifetime concussions as something more significant. But I would still go back and say, well, how many concussions actually is too much?
mm. So, as a rule, do you find that following these games, like you said, international games, do you, as a rule, do an analysis? Do you assess your patients or the players at the time, or is it as they report?
So that's where the difficulty comes in, and that's where we speak about prevailing attitudes. There's different motivations that you've got to remember at international level. A player earns a pretty penny to be on the field. A player has the prestige of getting caps. And then it comes with all the associated fluffiness that surrounds that, the adorations and all that nonsense. So again, when you try and set the motivations of what's happening with the athlete versus their actual diagnosis, potential diagnosis of a head injury, it tends to be quite challenging. But that's why then the tools that are there at hand are meant to just help you eke out some of these things. And then it's vital to also know your athlete because again, one of the things that athletes sometimes tend to forget, and I mean, it makes sense that you forget that when you've got a head injury, they tend to forget that, you know, like an athlete I saw recently who's a hockey player, after she hit her head on the netball court, her performance in the hockey on the hockey field drastically dropped to the point that I think her parents were saying she was trying to kick the ball in to score, which is
Okay.
not something you do on a hockey field. So that's what I'm saying. Players tend to forget, they don't notice that your performance is what you live by on the international stage. But having a head injury, having a cognitive disturbance like that ends up affecting actually how you perform in the greater scheme of things.
Of life, yeah. And word is being requested by Dumeleng Mutlong about boxing as well as karate. I mean,
Sure.
yeah.
Um, I'm not a good commentator or commenter on those two sports. I've not been significantly involved in them. I've worked in boxing at one of the, what is it, at the African Games or at the Youth Games. But I'm not a fan, to be honest with you, of the pugilistic sports. I think mixed martial arts is stupid. Forgive me for anyone that is participating in it. I think I just don't get it. I think the purpose and the aim of some sports is to actually bring out concussion. And then the big question is, well, then if that is the purpose, then how many hits is too many? And when do
Yeah,
you stop?
exactly. Exactly right. And so you see refs jumping in. Sometimes you see even players that are pounding someone else
Yeah,
stop because the person is
yeah,
no longer responsive, which is
yeah,
exactly what I wanted to put forward here as
yeah.
Professor Duplessis is asking. It says, once you see these significant injuries or these injuries that are repairing, you see major signs, and just advise the athlete just to stop practicing the sport altogether.
So it's interesting, right? Um, I think it would be nice to have a debate about would you give a professional athlete, professional rugby player, whose livelihood, who has like put everything around it. It's a professional athlete who has two children, a wife, responsibilities, maybe even family responsibilities, black tax, call it whatever, has all these things. And this athlete now picks up a concussion where you deem that the nature of the injury warrants a consideration of end of career. Sure. They're very challenging questions to pose whenever they come up. Because again, um, people's vocations are very close to their hearts.
Mm.
I just know that with some Springbok athletes, ones that I've known from youth level, whenever, and especially, one in particular who for me has had quite a lot of head knocks. I think we reached a point where I actually did ask the question that, look, you have a wife, you have a newborn boy. I just don't see what more there is to this rugby thing.
Mm.
If this is what's happening to you consistently.
Mm.
And some players have been brave enough and bold enough to make the decision to end their careers. A guy like Patrick Lambie was bold enough to make that decision when the head
Yeah.
injuries were too many, and it makes sense because you've got the rest of your life, you've got one brain, there's no transplant for the brain, so you need to do something about it.
Mm. Yeah, so good Martha Dwaba, yes, saying excellent talk, Doc. She considered to be quite eye-opening. Now she's also a concerned grandma. You were talking against your son playing rugby, and so she also
Yeah, he
wants to
plays tag
know.
rugby.
Oh, he plays tag rugby.
Yeah,
Well, a certain very famous athlete doing 400 meters played tag rugby, right? Affecting his career
and
as
he
well.
got hurt.
He got hurt,
And he
yeah.
got hurt.
So we expected more things from him. But yeah,
Mm.
so she wants to know how young is an appropriate time for a child to start playing rugby? Is there a time where the chances of injuries are reduced and so they are 5 years old, 6 year old running around the field, the own chances are minimal? What do you suggest to that?
I think one of the things that's important is to assess the readiness of an athlete to actually participate in certain sports. If you don't have the coordination process to be able to place your head in the correct place, to be
Yeah.
able to wrap your arms in the correct way when making a tackle, then should you be making tackles? And I think one can try and stage that according to ages, which I think if you look overseas, even the English Rugby Football Union tries to quantify that to a certain age, so they tend to try and move the sorry, entering into contact rugby to a later age. I think it's either 12 and above or 14 and above. And again, one can ask, well, is that of benefit? Does it improve, or are there other things that are being worked on before those kids can enter into contact? I just think you need to know that your child is safe enough, coordinated enough to be able to put their head in the correct place, not in the wrong place, coordinated enough to be able to wrap in the tackle and place their head appropriately and place their shoulder appropriately on the opposition player without hurting themselves. If you cannot see that for yourself and there are things that concern you about the technique of the child, then I don't think that child should be participating in contact rugby. I think you need to really relook, have a good education phase first that prepares the child to be able to handle that kind of a injurious load.
Yeah, so with regards to clearing, child, I have a question. Yeah, are parents allowed to basically follow from an ICC specialist point of view? Like, how do you get parents to participate and able to also monitor at home, right? So it's not just for what happens or when the child is taken to a doctor. You would see parents, I mean, have children at home. They see their behavior, see adjustments or anything like that. Signs that they need to look out for. We talk about signs, but surely there are symptoms or behavioral changes and the like that could
That's
affect.
it. So it's funny when the children improve, right?
Mm.
It's strange. I liken it to like a light bulb switching on. Like the parents, they speak to you like something just changed all of a sudden in their child. Their child is back to normal. Now, um, I just think you still need a good approach and a good process, right? And I
Yeah.
think you need to have your processes fleshed out. You need to write them out clearly for the parents to follow. And in that, if your perspective is to consider adding the question of symptoms and being able to assess the symptoms regularly, I think that makes sense because looking at the athlete pretty regularly allows you to make that kind of assessment and assertion as to whether the athlete can actually return to sport, return to school first, actually, and then return to sport. So,
Yeah.
I know of a colleague, Richard Marsh, who's now trying to adapt this kind of scat form and has taken the symptoms and has put it into an app. And again, the question is, I think it's a good thing for a parent that doesn't necessarily have time to go and do it, by rote hand. But I think if you as a parent have the capacity to do it, I think it's okay to prepare, in a modern day world like this, to prepare, I don't know, a Google sheet that you're able to just answer on a daily level that allows you to just track the progression of symptoms, whether it's a positive progression or a negative progression. If it's a negative one, well, it's good because at least then you can alert your clinician. You can take your child to a more specialized clinician, a neurosurgeon or a neurologist to get more assessments, perhaps if there are other parameters maybe that are being missed.
Mm. You were speaking about normal, and as you said the word, I saw Prof. Duplessis comment was like when a bone breaks and we see it healing, but it's never really normal ever again, right? It doesn't go back to its
Yeah,
initial structure, its form. So there's always an impact thereafter. So also a question here is, do you see the value or that there is some level of responsibility on the part of schools? I mean, they are exposing these kids to these sporting codes, and if the coaching, for instance, is suboptimal, where a child is not taught to tackle appropriately, I'm going to come back to David Milner's question shortly. So those kind of concerns, if that is what children are exposed to and they're expected to perform at this level within a school sports environment, that they provide the necessary kind of support, medical assessment from time to time, just to keep that evaluation as well. Because surely you can't introduce something into an environment and not have safeguards to mitigate risk thereafter.
absolutely. I just think the responsibility is on the school. I mean, the case where the child, there's two cases where children have had second impacts. Excuse me. There were different schools. Um, sure. I'm trying to mind my words because it really didn't sit very well with me how the child was managed from an A&E perspective, from a parental perspective. and then from a school rugby coach perspective. From an A&E perspective, I think a bland sort of you're out of rugby for 6 weeks without any other clear multidisciplinary referrals or sort of understanding what you can do to help your head injury was given. I think from a parent perspective, there was a bit of ignorance with looking at concussion as a, come on, boy, just get over yourself. This is not a big thing because no one can see there's no broken bone to see. There's just a person that looks different. But therein lies the frustration for some parents. You should just toughen up, get some cement pills, whatever it is that's usually said. And then from a school coach perspective, again, the same rhetoric, but now from a person that in theory can place your child at risk, by returning them onto the rugby field before they are physically safe to do so. I think there's culpability from the schools, from the school coaches, and I think it still has to be emphasized a little bit more significantly. Because I think, the people that sit with the burden of it at the end of the day is the family. And looking at the families, speaking to the families afterwards, um, it tends to be quite a devastating process, man, or a devastating conversation. I think the desperation from parents wanting their children to be well, who haven't been well for a long time. I think sitting across the table from people having those kind of discussions is challenging.
Mm. Yeah, look, it's you speaking about the conversations. So one of my colleagues. So I also played provincial rugby at some point,
Mm.
and so one of my colleagues, when we were at varsity, we both studied medicine, and then he had a fracture. So he's now in a wheelchair himself, right? So all these years.
Mm.
So it is a personal conversation as well, and the fact that the initial management is so key for the
Yeah.
children, it should be readily available. Going back to David Milner's question is about, you were talking about the tackling and where a significant amount of those impacts and the injuries occur. The focus is often on I understand, the defensive player, right? Not to, you had Sia's picture there earlier on where the attack or the tackling needs to go. And the question is just, what about the attacking player? Shouldn't there be some emphasis on the attacking player's position as well? Because some of them come in quite aggressive, right? Some of them are quite they use their arms, their elbows, the way that they
Yeah.
position their knees. Isn't there
Or their
some?
entry or their entry into contact is head first,
Yeah,
where they drop their heads, basically a dip. What's funny is it's strange, right? But I think in professional rugby, there's an encouraging of the idea of getting close to a tackler
yeah.
and then dipping as quickly as possible, so as not to give the tackler the opportunity to adjust their height.
Wow.
And the effect of that potentially is a tackler that will hit you higher than the sternum,
Mm.
and potentially picks up a caution, whatever, yellow card, red card, or penalties created. And it's a hard one because, sure, um, a lot of education also has to go into what's spoken to ball carriers players. I mean, if you look at that form that I was requesting, that if you could just send it into the chat, inside there, it actually emphasizes on one of the pages, it emphasizes this thing of the tackle height, the carrier height, where the carrier basically is carrying in a bent position. And basically, it's almost like they're going head first into the ground. So I think the rules have tried to protect tacklers from that, which they were hoping would discourage the carriers. But I don't know how much discouragement there is because there's still the reward on the professional level of an athlete getting a card and basically giving your team the advantage because the opposition player didn't dip quickly enough.
Okay, we will post that PDF that you sent me on WhatsApp. I'll place it on the group
Yeah.
chat. So it comes back down to, the way you're saying. I think there are a few considerations from the attacker's point of view. Again, similar to what we just discussed. Although there's an oversight of it during analysis or review, but attackers are also prohibited from going into a tackle in an illegal upright position. Because
No, in an illegal downward position, almost dipping your head into contact on purpose. So
So 10,
there is an emphasis on trying to look for that the carrier shouldn't be running to meet and then doing this on
yeah, yeah,
purpose
yeah, on purpose to try to elicit or draw some form of, like you said, a penalty against the one who is,
or a
uh,
card.
yeah, or a card for that matter.
Mm,
Yeah, so again, we have here, says the question. This is from Kizito Machache saying, thank you very much for your informative talk. My question is completely unrelated to concussion. Is there
mm,
anyone who can provide advice to social athletes, particularly marathon and comrades runners, because it's coming up, in relation to nutrition, sports supplements, and management of sports
mm.
injuries? Says, yeah, I've got friends who can benefit a lot from the professional advice along these lines to improve their athletic performance and manage their health. I
Cool.
mean, you are seeing your athletes go through quite a rigorous physical process and, I mean,
Yeah.
season. So what is it that you're finding? We
So
can
one
get
of
back
the
to
joys
you.
that we've had at
Um,
the Springboks over time, which took a long time, was we saw that some of the opposition teams basically were hiring nutritionists and dietitians, and that was directly having an impact on their performance. I think if you're looking for something like that, I think there are good people out there that are worth speaking to. The current Springbok dietitian, Robin surname. I can send her details to you, but she is definitely someone we're speaking to. Zinat Simji has been doing that. She seems to be maybe participating in paddle as well. There are many people I think that are busy with that can give good sound advice in terms of eating for performance. So I think an interesting one in sports and exercise medicine, right? Because it would be nice if the sports physician was like a one shoe fits all, but I think there is a multidisciplinary kind of perspective to it, and I would argue that where you're looking for specialized care, especially in and around your races, you're looking to see what your fueling strategy should look like from kilometer to kilometer, and
yeah.
with a perspective of trying to build performance. I think then it's worth it to actually spend the money, go and see someone that's really specialized in that field, someone that will give you quite good benefit as well from that perspective.
Yeah, I was speaking to
If
basically,
I may say something, just
sure,
to
sure.
quote. Because I want to quote a colleague who's currently under fire at the moment, Rob Collins. I remember one of the major things he pointed out was, when he was required to do, as part of a program where we were doing chronic and lifestyle disease management, and he was going to, there was a requirement to do stress ECGs on patients. I think Rob turned around and said, you know what? He said to me, I'm not a cardiologist. I don't think I'm going to sit and step into a cardiologist's domain, just so that I can make an extra buck or two. So I think it's important that you consider that there are people that are well prepped, well versed
They
in this
do. That's
space.
what they do. Yeah, that's exactly what they do. So I think, as I said, our program is quite full, but we'll make space prior to the comrades to address some of these questions that are coming up.
Mm.
And Dore is hi. The question is, what is the appropriate age for children to start, especially long distance running? I know we are not specifically on the concussion because you say she often does these preparations for 14 um, year old and older, and they do these 10-kilometer runs. And more
True.
parents are asking
At age
children
what?
14
Age
and
10,
14 for 10-kilometer runs. So
14.
yeah, so age 14, and more demand is coming in for children less than 14 years old to do these 10K runs. And so there's obviously a
Mhm.
concern. And I think you see it. Younger and younger athletes, whether it's soccer, whether it's rugby, all the different sports, these
Mhm.
children are being exposed at a younger and younger
At
age,
age.
and they seem to be these proteges and praised for it, right? In cricket, we see it all
Mhm.
across the sporting codes. Surely there has to be some level of guidance and cutoff of some sort.
Yeah, look, I'm not sure unless I think there are guidelines around what would constitute a safe intro into certain activities. My suggestion is I think it's best to always have an individualized approach with athletes. I think I'm seeing that more and more, even in trying to manage concussion. I think when you know your athlete, you know, and you understand the sport and you understand just the rigmarole of it all, you understand exactly how much what you think the kind of strain that would be placed on those joints would be, I think then it makes sense to make decisions then that are safe for an athlete to participate. I think what's interesting is in some of those programs, it's the parents, I think, for me that drive this. My son or my daughter can be a Springbok. It's the parents that are living vicariously through their children, and that are pushing that process. And you tend to find that that process ends up being associated with a lot of injurious events for a developing athlete. I do not necessarily recall the guidelines or having seen guidelines that were very specific around the age groups related to running. I've seen the ones related to tackling in rugby, um, but I'd have to look it up for you and get back to you on that one.
Thank you so much. I see in the comments quite a few people are assisting answer some of the questions. And I see here, for instance, there's Tandega Mhlanga. Tandega, thank you for that. We'll reach out to you. Tandega is a sports dietitian and also a
Mm,
marathoner. She also does work with runners from track and
mm.
field, ultra marathon athletes herself. So I will get in touch with you hereafter.
Awesome.
Sandega, thank you so much for putting your hand up and assisting with regards to that and seeing what you find. So I really do appreciate it. We've got your number there, Sandega. We will definitely get in touch with you hereafter. Yeah, if there are any further insights, closing remarks that you wish to share with us now, just for a take home, and what it is that you would like people to be taking to the fields, to their children. You hear their grandmothers, grandfathers, dads that want their children to
Yeah.
be sports athletes, right? So there's a lot of pressure
Yeah.
in the space. So if there's anything that you wish to share at that point, please feel free to express
I
that
think the
as
major thing for me is education. I think step one, educating and awareness just around this issue of head injuries. I think that's vital. And then I think good recognition and management in a multidisciplinary setting as colleagues is the next step that's also vital. I think I would say, throwing it out there, we need to move away from working in silos, prescribing minor things without thinking about just the long-term effects on the athlete. While things may never be the same, you still have an opportunity to rehabilitate. You can look and say, well, if I'm confident enough to rehabilitate an ankle injury, why am I not rehabilitating my brain when it's had an injury? You need to do that. So I think those are the things I'd like to put across, that I think we have that responsibility as colleagues, to set up the idea of multidisciplinary management of head injuries. And we have the responsibility of educating and really taking charge whenever these incidents occur.
So thank you very
Mm.
much for availing yourself and being here with us this evening. And then to our colleagues who are joining us week on week, I know there were more than 600 of you this evening. We really do appreciate your time, your attendance, and staying through to the very end. We really appreciate your expression of appreciation. So thank you for that. Next week, again, quite an insightful presentation by one of our professors who will be presenting to us. And I did take note of the request for somebody coming forward and speaking on injuries, running, and the rest. So maybe we'll put a multidisciplinary team on
Mm.
prior to the
Mm.
conference and
That's
see
awesome.
how it is that we can prevent injuries, because many of the athletes will come back and need your assistance once they return from these races or during the course
Mm.
and preparation, of course, for that, and not just getting multivitamin drips, which people used to come to me for. So very much we are appreciative to the Clinix Health Group for sponsoring this evening. We thank you so
Mm.
very much to all our colleagues in the background, Neo and Tolakele, as well as Sister Nasisa. Thank you so much for putting this together. I know you'll be responding to everybody in the groups, making sure they get their points. Yeah, we hope that you all have a wonderful evening. And please go rest. Thank you so much for your time. Thank you so much, Dr. Mampane. Thank
Thank
you.
you, everyone. Thanks for the time.